Network. I'm going to be sort of emceeing this virtual webinar today. I just want to start off by acknowledging that wherever we're zooming in from, we are on Aboriginal land across the country, and I want to pay my respects to all those respective elders, past, present and emerging across all different country. So yeah, this afternoon we're going to have Damian Griffis. We're going to start with him. He's the CEO of FPDN. He's going to give us a bit of information about who FPDN is, what we do, and what we're actually doing right now amidst this COVID-19 situation. Then we've got Rochelle Pitt from Queensland Health after Damian, and then she's going to talk about infection control, and then we're going to hand over to Craig Brown afterwards, who's going to talk about self-care and looking after ourselves during this time. So Damian, I'll hand over to you.
Thanks, Tori, and welcome everyone, and also like to add my acknowledgement. I'm speaking to you today from Darug country in northwestern Sydney. I'm a proud descendant of the Warramai people of the Manning Valley in New South Wales, and have had the honour of being the CEO now of the First Peoples Disability Network for 10 or so years now. So yeah, as Tori said, I'm just keen to provide a bit of an update on what we've been doing at the First Peoples Disability Network with regard to coronavirus. Talk a bit about what we see as some of the priorities, but really keen to get feedback from everyone online today about any issues that you're encountering. And obviously got Rachel and Craig talking a bit later, which is really important for everyone to listen into. Our plan also is to make this a regular way to keep in touch with people. So this is a first of what will be probably many webinars to come over a range of different issues. And we are finding, I think, that this is a really good way to keep in touch with people during this difficult time, but also more generally, I think this Zoom teleconferencing thing has quite a bit of potential, really. But just for those that aren't aware of who we are, we're a national organisation representing Aboriginal and Torres Strait Islander people with disability. We can trace our origins to a gathering of Aboriginal and Torres Strait Islander people with disability. It was held back in 1999, actually, in Alice Springs. At that meeting, which was supported by ATSIC back then, every state and territory sent a male and female Aboriginal person with disability to that gathering, and a number of recommendations were made. And one of those was for people to go back to their states and set up state-based networks to sort of be a voice for our people with disability. And myself and Uncle Lester Bostock back in 2002 began a New South Wales network. So the idea was really just to try and create a voice for mob with disability. And one of the ways we did that was to go around New South Wales and talk with Aboriginal people with disability themselves and their families. We didn't talk to the service system, we talked more to people themselves to hear about what was going on for them. So Uncle Lester and I did that together with Auntie Kerry Reid-Gilbert, who we sadly lost also last year. So we did that work. We visited 30 odd communities, and as everyone would imagine and already knows, that raised so many issues that probably hadn't really had proper attention before. We heard about very serious examples of discrimination in education, employment, access to health services, you name it. And we wrote a report called Telling It Like It Is, which is still sort of one of the first reports based on direct conversation with Aboriginal people with disability and their families. We were never funded really through this time. Our funding came from the private sector, actually. We got small donations along the way. And I was actually employed by People with Disability Australia at that time. So, and Uncle Lester and I had a little office in Redfern, kindly provided by People with Disability Australia, but we didn't really get any success with New South Wales government funding, probably because they didn't like what we had to say, to be honest. But we'll take that as a badge of honour, I think. But it wasn't until we saw so meanwhile in other states, actually, at the same time, there was attempts to grow networks. There was a network in Queensland that was trying to get moving and was going okay, but we used to go up there and try and help them get their network going. South Australia had a committee that used to provide advice to the South Australian government, and Aunty Gail Rankin, who we also sadly lost last year also. She chaired that committee. In Western Australia, we had a sort of group of health professionals that were doing stuff, but none of these groups were formal in any way. They were sort of done by volunteers. So it wasn't until about 2007 that when Kevin Rudd became Prime Minister, there was an opportunity for us to talk to them about getting a national body going again. Because that group that met in 1999, when ATSIC ended, any opportunity for growing that went with that then, unfortunately. So when the government changed, we got a small grant to grow a national body. And what we had done over the years is found various people around the country who were leaders in their community, who were Aboriginal people with disability, who are already well known in their community. And we brought all those people together in Sydney over a few sort of workshops and grew the national body that way. And we elected a committee, and that was first chaired by Uncle Lester, and then was chaired by Aunty Gail Rankin. And it was very unique because we had built the first ever what is known as an Indigenous Disabled Peoples Organisation, the first in the world actually. So each of our board members have disability. That's still the case today. And our members are Aboriginal and or Torres Strait Islander people who have disability. So very unique in Australia, but it turns out unique in the world. There isn't an equivalent one. Maori don't have a group like ours. Either do Indigenous Canadians. They've got some regional ones, but not a national one. So our board was made up of people that have physical disability, intellectual disability, psychosocial disability, mental illness. We've had board members who are deaf in the past, blind members. So the idea really was to create a voice of and for First Peoples with disability. So we had a number of priorities over the years. We weren't a service provider. We've never sort of been able to do that, never wanted to do that necessarily. What our role is to be sort of a representative voice and talk to government and service providers and anyone really who's relevant about what the needs are of our people with disability. And as everyone knows only too well on this webinar, that the needs are incredible, and we'll hear more about that from Rachel and Craig, I'm sure. But we have very high rates of disability, very serious disadvantage. Most Aboriginal people with disability would live in poverty. Very few Aboriginal people with disability, sadly, are in employment. A lot of young Aboriginal people with disability don't get to complete an education, or maybe don't even access an education at all. We have very high rates of our people with disability in prisons all around Australia. So we have some very serious issues. And we say at FPDN, it's difficult to think of any more disadvantaged Australians really than Aboriginal and Torres Strait Islander people with disability, because they face discrimination, as we all know, based on Aboriginality and disability. So a very serious human rights issue, and difficult to think of any more serious in a lot of ways, we would say. Yet, as a lot of us would know, it's still largely overlooked. So we would say that continues to happen because we have such a dominant kind of medical model. So very dominant, and I'm not saying that to be controversial, it's appropriate that be strong Aboriginal health sector, of course, but that doesn't address disability. It's more about primary health care, and that's not a criticism, it's just the way it's set up. Whereas we are about the whole of life. So disability isn't a health issue. Disability is an education issue. It's an employment issue. It's a transport issue. It's a access to services issue. So, and it's a human rights issue in the end. So that's the reason really why we set up. Uncle Lester Bostock was a driving force behind this movement. His work began in the early 1990s. So he was talking about double disadvantage way back then. A lone voice in many ways, and he was a critical part of creating the culture for our organisation, and we miss him all the time and think of him all the time. And we've also lost Arnie Gale Rankin last year, and she was a driving force and a great mentor to all of us. So want to acknowledge them and want to acknowledge all the people, and acknowledge Arnie Maureen Logan, who's on the call today, who's been with us from the beginning, and all our board members and all our staff. So we started very small. We just had, one staff member, then we became 2, and now we're at the point, I think, where we've got about, I think it's 9 full-time staff located in different parts of the country, and we're growing, but still can't get anywhere near meeting demand. And I think we all know that feeling. So that's a bit about the First Peoples Disability Network. In relation to our work around the coronavirus, we obviously, like all of us, are very, very concerned. And whilst the curve seems to be flattening at the moment, and certainly hope that continues, and it appears that things are going okay, we're still very concerned about the lack of focus, the lack of a plan really on coronavirus and our people with disability. So there's definitely some work that's sort of happening in the health sector, but not enough in our sector. And we've been doing a number of things to try and address that. So I was just going to talk about sort of 5 key areas in relation to our response, and then hand over to Rachel and Craig, who got some really important stuff to share with us from the ground, from community. But we've sort of divided our response into sort of 5 areas. So the first one is relates to communication. So my colleagues, Lisa Hyman, Tori, Ben, Junie and others have done an amazing job in developing our own communication. So you can get access through our website, but we've developed some short films that explain sort of things like social distancing, washing your hands, and other important messages. And we've also done an Auslan, thanks to Joanne Aegis from the Deadly Deaf Mob. She's done an Auslan sign language version of that for us. So we'd really encourage people to access that and distribute as widely as you want. We're not precious about that. That's really important information to get out there. I've been made aware that that's now gone as far afield as to Canada. The Indigenous community in Canada are using it. It's being so well received, and I think that shows how well it's being communicated, but a really important resource. We've been behind advocating for some new developments. So there will be a disability hotline established. Not necessarily, a lot of our mob probably won't access that, but it is an important resource to know about nonetheless. And there'll be some public announcement about that probably tomorrow, I think, or very soon. The idea is that's a source of information for people around a range of different things. We're also been doing a lot of what we would call systemic advocacy. So we've been sitting on a number of task force. So the Department of Social Services has established a task force for people with disability and the coronavirus. We're now on a Department of Health task force thing. And we've also been discussing with the National Disability Insurance Agency a range of their responses. So just to bring people up to date there, I guess one of the criticisms a lot of us had in the disability sector, so I'm talking more broadly now, was there was a lack of focus, a lack of attention. So we, together with Women with Disability Australia, who are the peak organisation for women with disability in Australia, and some other peak organisations wrote an open letter to the National Cabinet. So, and that was identifying 10 key activities that need to happen for all Australians with disability, including our people, and we were very prominent in that. I can report, and maybe I'll say this a bit cheekily, but I think that's probably scared government a bit, and that's probably exactly what we wanted to achieve, to be perfectly honest. So, and I hope it's not anyone from government. I don't mean to be disrespectful when I say that, but that probably is what we were trying to achieve. So I think that's hopefully going to get things moving. The Department of Health has obviously, as the department that has most involvement in coronavirus, we needed to engage with them, and we've been moving that along now, which feels a bit more positive. But what's been obvious, and one of the criticisms we had in the open letter to the National Cabinet, was you just don't hear the Prime Minister, and all of us that work in disability are only too familiar with this, but you never hear the Prime Minister, you never hear a state or territory leader even mention people with disability. If they do, it's very, very rare. So how can it be that, and rightly so, that aged people get proper attention, as they should, but how can some of the most vulnerable people not get a mention? It's the usual disability experience that we all know too well, only too well. So the risk, so the other thing we've been talking a lot about is the need for a phone-based kind of outreach system, where, pretty simple idea really, nothing too scientific, but just where FPDN and even other Aboriginal community organisations can get resourcing just to ring around and ask a couple of simpler questions of the people we know. You know, how are you and can we get you anything? And we're still working on hopefully getting a version of that up so that it's just a simple way of asking around and checking how people are going. It's not very scientific, but we think that's really important, and hopefully have some good news about that next week, and be keen to talk to anyone who's interested in working with us on that. But that's a very simple phone-based outreach. It's the only way we can do it anyway, keeping in mind social distance stuff. But just to get a better, I think sometimes people just benefit from a phone call. And I think so it's just a simple idea, but, and also using, you know, the Koori grapevine, Bush Telegraph or whatever, and someone will say, no, I'm going to write an art down the road, could do with a hand. That's all we need to find out, I think, sometimes, and we might be able to assist in some ways there. The other fourth issue that we're very concerned about, and really, if people are joined from regional remote parts today, we're hearing, and you guys would be much closer to this than we are, but we're hearing that there's a growing problem in terms of access to food and supplies and medical supplies, particularly in regional remote parts of the country, and it's now starting to be reported in the media. But if there's issues there, please let us know, and we will try and shake the right tree to get things moving there. So I guess our role here is to sort of talk to government from the ground, from what everyone tells us, to try and get some change. I'd have to say the Department of Health has been pretty good to talk to so far. So, I mean, they know they have a problem, but I think they're receptive, but really keen to hear from everyone. Probably the best way to do that sometimes, if that's okay, is just write a paragraph or two in an email to us, and it doesn't need to be a work of art or anything. Just tell us what's going on, and the more information we can get, the better. Because I'm just a little bit concerned about, you know, I'm not a little bit concerned, really concerned what the situation is in regional remote, especially, as I'm sure a lot of us are. The fifth issue is one that we're decided to take a lead on, and really keen to get input from everyone on this issue. So there is a huge ethical concern if the virus was to get out of hand in Australia, and it doesn't appear to be happening that way at the moment. So that's a great thing, a really great thing, but we should still plan for this anyway. We're not hearing enough discussion about the ethics of access to intensive care for people with disability. So we've made a decision as an organisation to get on the front foot there. So a small group of disabled people's organisations have come together. There's about 4 of us who are producing a document because in situations of pandemics, as you could all imagine, there is a very grave risk that people with disability, including our people with disability, or especially our people with disability, will be triaged out of intensive care. So a scenario we could imagine. So I think if I remember right, there's 12 ICU beds in Tamworth. So if there was hypothetically an outbreak, and let's hope that doesn't happen, and it may well not happen, but there's a serious outbreak in Tamworth, and you presented to the hospital as a 51-year-old Aboriginal male, diabetes, smoker, psychosocial disability, maybe a bit of drug, alcohol, then you're perhaps going to get triaged out. If you not perhaps, I would say yes, you will. So we need to guard against this. We need to get on the front foot of this. So we've been talking with some I can hardly say the word, ethicists who are assisting us to name this issue. If we don't, I've got really serious concerns. I'm sure all of us do. In America at the moment, surprise, surprise, more deaths are happening amongst African Americans and Latinos and poor people. So, and that's for a lot of reasons. They don't have universal healthcare like us. So thank God we have that, at least in Australia, I guess. But it's also because in some states they use a points-based system for triaging. So we don't want to have that in Australia because that'll immediately disadvantage Aboriginal people and especially disadvantage any Australian with disability, actually. So we're not hearing enough talk about this and enough leadership about it. So there's been some conversations with the peak body for intensive care units. Doctors in these situations make very, and I'm not meaning to be controversial when I say this, but they make very cold and calculated and decisions, I guess. And we need to set up some protocols that protect. And there is a human rights approach that can be taken, and ethicists can write the language. We just need to produce the stories. But I'm getting more and more anxious that we need to articulate or write this down. And there's also the elephant in the room of plenty of our regional hospitals, a lot of our people don't like to go to because they're racist. You know, some issues we need to get on the front foot about. So that's probably another big part of our focus. But just to summarise, I realise I'm talking at everyone here, and I hope that's okay. But we're just very keen to hear what's happening on the ground. Our role is to feed it up to decision makers, really, in this situation. The only other thing I would say, sorry, is we are having conversations with Woolworths. I've been made aware of the IGA, is it called a gift package or whatever it's called, which sounds like a good one. And we've had approaches from even a Muslim charity to get some things out, which is greatly appreciated. But if you identify, you know, and I think to make it worthwhile or appealing, for want of a better word, to Woolworths and IGA, we'd need a minimum of sort of 20 or 30 packages to go out. But if you're out in community and you know that they could do with a delivery of stuff, then let us know. We might be able to coordinate something there. Woolworths are talking to us, so that's good, because we also just want to get stuff out to people, particularly in regional or remote. But yeah, we want to feed the stories up. So if you're hearing stuff, I don't think we've quite. I guess the other thing, you know, I guess the only other thing I'd say is I just worry that things haven't come to, the virus hasn't come to our communities yet, but it'll come. I hope it doesn't, but just we need to be proactive instead of reactive in many ways. And sort of the human rights approach is going to be really important. So, but I might leave it there. That's the sort of the big picture sort of stuff. Rachel's going to talk about some really practical stuff, and I know Craig and Libby got some really important things to talk about around mental health and things. But please, yeah, get in touch with us. Get in touch with the team if there's anything you're hearing that you want a hand with, or that we can go and talk to decision makers about. Yeah, I'll leave it there. Thanks, Tori.
Yeah, thanks, Damien. Well, we'll just move right along and hand over to Rochelle. Did I say your name right? Sorry.
Yeah, that's right. Thank you, brother Tori, and thank you for that your talk there, Damien, as well. Just gives myself a bit of background. I was asked by Auntie there to come and have a talk about myself. So I'm a registered nurse, Aboriginal and Torres Strait Islander. My background, so I'm Noonuccal and also Kalkadoon, and also from Arab. My Pitt family's from Darnley Island in the Torres Straits. Yeah, so I've been a registered nurse for 24 years now, and the first time I had anything to do with the First Peoples disability peak body was when there was a conference on. I don't even know where was that conference. It was in New South that time. I was invited to come along. My background is in renal nursing, but in that time I've looked after many of my people, especially those with disabilities as well. Sometimes it goes hand in hand, you know. There's a lot of our mob with their chronic conditions. Their chronic conditions can become a disability for our people. And anyway, I'd just like to also pay respects to traditional owners of the land that I'm here at the moment too, which is the Turrbal and Yagara people. And yeah, so I'll just really, at the moment, you know, this has really just become so overwhelming. This is you know, our systems really, we're not built to handle anything like this pandemic and the fallout that could still happen. There's been certain things put in place, and I think the social distancing is being put in place as quick as it has been has definitely helped. I myself in my job here am a nurse navigator, so this is a fairly new position. It's been around for about 4 years in Queensland. But we're like I'm in an identified position as an Aboriginal and Torres Strait Islander nurse navigator. There's not many of them as well. So there's another fight that I have, which is pushing for more Aboriginal and Torres Strait Islander nurses in the public health system. I specifically look after my mob as well, and those with complex chronic conditions. I found that would be probably another good thing to fight for would be having a disability nurse navigator position, because there's still not enough support or resources for our mob here in Queensland Health. And I'm speaking from this public health perspective because that's all I've worked in, especially primary health care as well. I was with Apunapima Cape York Health Council before I came here. The resources that I could get wasn't really much at all. I work Aboriginal Health here where I am in Metro South in Brisbane. We're sort of pushed under the umbrella of health equity. So we work together with the disability area and also multicultural health. We are pushing and fighting to get an Aboriginal health section by itself, and that's supposed to happen this year, but it's on hold at the moment. And most definitely for my people, disability, especially in the disability area, that's something we definitely have to work on, and whether or not we, in case this happens again, not just a pandemic, but you've also got, you know, your environmental disasters that can happen, you know, your floods that we get here, cyclones that we get up north. And there's nothing really in place, you know, a pathway of care, not just for our mob, Aboriginal and Torres Strait Islander mob, but also those with disabilities as well. So you're learning, I'm learning as we go along. We've still got people that don't even have their NDIS plans in place yet that we're still trying to do. So my first thing when I was asked to come and talk here as well was to ring up my sister girl from up in Cairns, Sister Melisha Obar, and she sent me through a few photos too, you know, to show me what she does for her son up there. And there were some good ideas, but just little sort of processes and little plans that they put in place, especially when they have carers coming to home. I know with myself, I am very particular with the hygiene and the social distancing. I'm wearing my mask now. I'd love to maybe down the track push to get a budget for our mob, because they're always asking me for masks, and if I've got it, I'll give it to them as well, because I want them to feel some sort of safety, in their environment or whenever they need to go out and get around. So yeah, I'm always another problem that we have though is that we're running out of PPE. They do say we have stock, but we're kept in the dark a bit with it all. So I'm just reusing my masks as much as I can, and just being very careful in what I do. I have immunocompromised clients. Yeah. So anyway, and it's hard because you're trying to talk with your bosses usually, who are, or your manager, who is non-Indigenous as well. So you always have to stress, this is more important. Our people are, high needs clients, so we need to be a bit more vigilant in the way that we approach their health and their situation. Yeah, so there's a sort of a lot of work. I think this though can help start to facilitate and give us direction in support for our mob in this time of need. But a lot of them are pretty good. I just try to, as I said, when I go and visit, I'm putting my masks on. I'll show you I've got some little deadly things here that I was going to show you all. Okay, so we've got that's the N95 or the level 2 kind of mask that we use. And this is only supposed to be used in the situation if your client is sick. But I like to, meaning sick with C19. I still probably would use this if there's the flu, flu season is coming around now. Also, we have the general masks, surgical masks as well. Had to borrow these. And I encourage mob, if they want to, make their own masks as well. I think there's some photos there you see. Sister Melisha there has some masks that she made. And it's more a general thing is, while it may not fully protect you, it's when you're out and about, it sort of stops you more so touching your face, touching your mouth, touching your nose. Yeah. I like this one. I like this one here first. I don't know if it's a little bit blurry. Yeah. People are making their own masks because there's just not enough to, in the shops. They're very expensive, these ones. Oh, that's me having the flu shot today. Just encouraging everyone for the flu shot, please. Another thing, it's very hard to, so there's no process in place of how to give your flu vax in the home setting as well. So we have to get our clients out to the doctor. A lot of them are a bit fearful because the big crowds. So they're looking at actually, if we can drive our clients into the, that's all right, enough photos. If we can drive our clients into the car park of the doctor surgery that they're at, we can give the flu vax there, but get the nurse to come down and give it. As long as there's the cold chain is still happening, so that the flu vax has to stay cool to a certain temperature before it's given. And of course, for anaphylactic purposes as well, if anyone has a reaction to that flu vax, the doctor's right there, and also the treatment that they need, it's quite quick treatment. So that's look at some type of home process put in place, but there's nothing yet in regard to that, because it's never happened. Everyone can always get into the doctor. There's no community nurses that do it here. They try and get the client into the doctor, and that's not always, that for disability mob, they can't always do that. We're doing a lot more of at the moment, I'm doing a lot more of the video consults and the telephone consults with the doctors and my clients. And I can come in there, I can do their blood pressures and all that sort of diagnostic testing that I need to do hands-on stuff, which I make sure that I'm gloved up and gowned up. In talking to a lot of the infection control people here, they're saying we can just use general precautions at this moment. You know, the advice that I get is from a non-Indigenous perspective as well. I always, for me being a nurse, Murray nurse, I always question that. I want to make sure that I'm doing the right thing by my client. The main thing though was the hand washing, the hand hygiene. And I always encourage my clients to get a bit of the alcohol hand wash, which is really good. And we do the 20 as well, which is really important. And I didn't know whether you want me to show you today, but I can, you know, another thing I'd love to get for my clients is the little hand washing card, which does step by step of what you need to do. If you have that little setup at home, are you okay? If you have that little setup at home for a lot of our mob, like you saw in that previous picture that Melisha had set up, you can ask your clients to always get or that's something, you know, I think if we can get a budget through Queensland Health or your public health section just for our mob, or PHN, I could talk to PHN about that, getting a box of gloves for our mob, some plastic gowns if they need it, and masks, because I'd say we're going to be doing this for quite a bit of time in the next 6 months, 3 to 6 months, that we'll be doing this kind of support in healthcare. I don't mind being a point of call as well for my clients. A good thing about this nurse navigation, I always send a text to my mob, you okay? Everything all right? I don't directly ring them straight away and they get back to me, or if I haven't heard from them, I'll ring them. And I found that's been really good, because in this uncertain time, people are very nervous and they're not too sure, you know, if they're doing the right thing. And it's just really having that voice from a nurse or, you know, a support person. I find here, though, the support people are usually there just to help their activities of daily living. It's always, in that health space, always good to have a nurse or a health worker, Aboriginal health worker there, you know, to support them. So I've been asked to do a little bit of a demo with this hand wash. See if you can. So we're told to do, like, 1 squirt is quite a bit. I do 2. I've got big hands. So what you do, and this is like the same with water. You're supposed to be singing happy birthday to you, Marilyn Monroe version. Now, Gavin, happy birthday. So you're just washing your hands, the palms, to you, the back of your hands too. Happy birthday. Happy birthday. And also fingers, tips of the fingers. Get in both sides, they're like that. Thumbs. Get into the thumbs. And this is more so water, you know, a little bit harder with the alcohol stuff, does run out pretty quickly. And then your wrists. Yeah. That should cover all of those points in the hand. With your alcohol, it just dries naturally anyway. But usually with water and soap is just, water and soap is fine at your sink, if you have a sink there, before you come in to look after a mob. I don't know if there's any carers on here. I'd love to have a yarn with some of the carers and or, you know, disability mob here too, to talk a bit about what they've done. It'd be always good to have some feedback there. I'm hoping the main message that has come out to us here with Aboriginal health side of things is just to maintain good hygiene, including your regular hand washing. When you're coming into the place of residence and leaving, throwing your used tissues in the bin and sneezing, coughing into the elbow or shoulder, limiting your exposure to people. That's isolation of sick people. So if anyone in your house, you know, with our mob, they always got more than 1 people sometimes living in the house. Just make sure if they get sick, especially this flu season coming up, to, you know, if they can, have their own, you know, place or their own sort of bed area. Covering your mouth and nose when sneezing and coughing, and no shaking hands. Just avoiding large gatherings, which we're doing at the moment. And to plan ahead for sufficient supplies of food, hygiene and essential items. And the only other thing I got when I talked with the disability support people here, Troy Hakala's his name, he's a social worker. They have a coronavirus essential items checklist, which is what they're offering at the moment for a lot of our mob. There's a little checklist of important things to think about, you know, just about food, and also, yeah, just having, I always, you know, a support person, because sometimes if I've found sometimes our support people are sick themselves and they can't come in and help. So who's your next person of contact? You know, is it your primary health service, or is it, you know, a family member? To always have someone there. Yeah, but there's a lot of work definitely need to be done, and I'm learning as I go as well, and I learn from my mob. But one thing I've noticed is it's really good to have someone like myself there as a specific nurse looking after my people, because I'm always in touch with them, even if it's just, you know, every couple of days or once a week, depending on you know, the level of care that they need. And just having someone they can ring and have a yarn with, hey sister, I'm not doing too good today, this and that's happening. Mental health as well is another thing. At the moment, there's no mental health support for my mob in the emergency department, because I'm getting some of my patients mentioning they just want to end it, you know. And that upsets me, but the only thing I can offer is, you know, just be in there for a yarn, but also, you know, maybe it's time we go into the emergency department. Maybe, you know, we need to get some more support for you. And then we went in and they sort of turned my client away or diverted him to another hospital, because there's mental health support there at the moment. It's all C19. And that really, I said to my client, I said, brother, let's just stay at home, bring your family around, let's get support for you now. And, you know, just having people there with him, it settled him. But I'm still concerned. It's like, it's just a little Band-Aid we're putting on these issues at the moment.
Yeah, Rochelle, I'm just conscious of time.
Yeah, sorry.
Yeah, no, thank you for the demonstration and all of that. And I'm just wondering if that checklist you've got, if you may be able to send that through, and we can someone that's interested.
Yeah, while it's not Aboriginal and Torres Strait Island specific, I think we can work on that, you know, and yeah, I'll definitely send that through to you, brother, right? I'll send that.
Yeah, if you could send that to me, and I'll distribute to anyone that's interested in that.
Yeah.
Thank you so much, Rochelle. That's some really great stuff you're doing.
Sorry for yarn too much, but yeah.
No, all good. And I think too, like, you know, some of the work you're doing is fantastic as well, just in regards to having.
Yeah, love to work with you fellas down the track, eh? Just knowing.
Yeah. You know, in regards to having our own Aboriginal sort of health set up there would be great. So I'll just pass on now to Craig from Aboriginal Counselling. You probably talk a bit more too about just the last point what Rochelle touched on, being the mental health side of things. So thank you, Rochelle, and I'll hand over to you, Craig.
Thanks, sister. First of all, name's Craig Brown, Woombangi man, North Coast, New South Wales, and you on South Coast, New South Wales.
Libby Brown, Biripi, North Coast.
We also want to acknowledge elders past, present and future, and also acknowledge the work that you fellas have done, not only to bring this together, but to emphasise the importance of keeping all our mobs safe, because it's been quite obvious in our yarns, and we know it's in our hearts, in our minds daily, about the lack of supports or the challenges we face in a lot of systems, particularly some public health challenges. My background is basically 20 odd years in mental health, public mental health. So Aboriginal counselling's come together probably for the last 13 years, but more now full time to focus on mental health. and look at how we can share ways of keeping our community safe. And I want to echo this point too, it's how we work collaboratively around supporting each other and certainly reaching into the hearts and minds of our mob to keep them safe. So again, thanks for the opportunity to share, and again, acknowledge the work that Damian, yourself, Tori, Deb and Auntie Juniors are doing, and it keeps us motivated to see what we can do to certainly motivate you fellas and look at this holistically. We call it culturalistically, because it involves not only social, it's emotional, it's mental, psychological, it's physical, and environmental. And some of those factors come into it where I think Damian touched on it briefly, was about financial, because there's a lot of financial challenges with it, with our mob, and some of the hurdles that are put in place is getting access to those services. Now, if you've got no walla nor money, it's challenges to even get into town. So we want to talk briefly about certainly mental health, some of the challenges, and what we can do to get in some supports. One of the things that come to my mind with even looking at what's happened in our past, well, just recently, without even going into the CV-19, has been the recent bushfires. Now, it's cause I've seen, and we've walked with a lot of mob around some trauma, how the bushfires impacted us, and now it seemed to be where I'm alluding to is that it's gone from bushfires to CV-19, which has really unpacked a lot of challenges, emotional challenges, and challenges with our thinking around, well, what are our mindsets right now as we speak? Is our mindsets around anxiety? Is it depression? Is it sorry business? But I look at it again from a holistic lens. I call it, it's worry business. We know it's worry business because we as workers, as mob, can usually manage, but now people, even yourself, Rochelle, that started to talk about the impacts of, all of us being on the front line. I really acknowledge how you guys turn up every day to deal at the front line which is now this COVID-19. Again, I'm challenged to be able to look at, we're all in lockdown. So what I say is that just because we're in lockdown, it doesn't mean that we have to lock our hearts down for others to be able to reach out and to look at what are some of the causes or symptoms of this. I don't have to go through a big list because I know how we think and feel daily is obviously the symptoms that are presenting itself. And I will read for you a few of the things that do come up in mind. And it goes with what mindset are we at right now. What is a mindset? It's a way that we're thinking based on our beliefs, but also what's going on in society. So there's all good mindsets, and there's also challenging or not so good mindsets. Again, some of the symptoms we're talking about is our physical symptoms. We could have physical symptoms like palpitations, heart palpitations. There's also other, sorry, I'm going to read a list here. I've just wrote a list. Panic attacks, it could hot and cold flushes, racing hearts, tightening of the chest, quick breathing. Again, I'm not here to diagnose. I'm just here to say some of these symptoms are symptoms of anxiety, but also we're not here to self-diagnose and say, hey, we might need immediate help. Now, if that is the case too, you don't want to confuse it with heart symptoms or physical symptoms of other illnesses, but being Aboriginal, we need to talk about these things because I always say there's no shame in yarning up. And to address this, we like to look at thinking out loud with what's going on in our minds, and also what groups of people within our communities are they impacting most. We always talk about elders and our mob that have physical and mental disabilities, our mob with disabilities. Our young people are always flying under the radar, which is quite challenging. And again, it always goes back to where our stats are getting worse around youth suicide now. I know recently out west there was 6 suicides in Moree, 6 down at Bateman's Bay, and maybe more since I was down there in January. There's lots of suicide attempts. It all comes back down to our current individual mental health status, emotional mental health statuses, and as I said, some of the physical statuses of how we present daily. Daily means way we turn up every day, we get out of bed. Is it going to be a good day? Is it going to be a bad day? We talk about communicating with others, checking in with others. So what I'm getting back to around self-care and how we're looking after is certainly how do we check in with people that don't have mobile phones? How do we check in with people that are challenged with technology and media? Because to me, some of the biggest challenges or the epidemic challenges in mental health is the people that aren't diagnosed or that aren't under our radar with our systems. Again, where it does lead to is suicide, self-harm, self-medication, other challenges around domestic violence. Again, there's a lot of media around domestic violence that's been amplified with our current situations. But again, how do we do it when we're in our situations in rural, remote communities? And how do we look after ourselves whilst in challenging situations? I say don't change dramatically, but just make those adjustments around what you do every day. We're in lockdown. That means I can't go fishing, Tori can't go fishing. But what it does mean is that how do we pause our life for a moment to, I say, hit the reset button on what we're doing. Hit the reset button on how we can make opportunities of being in lockdown. Lockdown doesn't mean, again, being locked up, but how do we live some type of, in a normal way within our homes or our backyards or in some of our communities with bringing normality into our life.
Can I just add that there's a level of worry that's helpful and normal. It is worry that makes us cautious and careful, puts us on guard to know that there's danger. It's when that gets beyond what is helpful. So what we're mindful of is that worry that then becomes overthinking and becomes hurtful and impacts our daily functioning and our desire to continue. And absolutely, our mob have got worry that's just sitting there. You know, we've already heard in media reports that, yes, we're more at risk, we're vulnerable, where there's chronic conditions, where there's disability, where there's challenges to access essential items. And I think, you know, supporting all of our communities to keep that perspective around that is the challenge. I think it's important that we're aware of what is true and what is myth, that we're looking to reliable sources to get that information. So did you want to talk, Craig, about some of the myths?
Yeah, but I will talk about some of the myths around coronavirus because, again, we're told a lot of things and there might even be natural bush remedies that I'm not aware, but I won't recommend it. But what I do recommend, Rochelle was spot on, is that the main thing that we just need to be focused on is our social distancing. And unfortunately, even my mob, I had to lock the door and keep our mob in, keep them safe and talk over the phone to other mob because it's natural to us to go up, cuddle each other, connect with each other, but we need to really consider how we can be strong at these times and still support our mob. And we go into a distant education mode where we check in and we do things more smarter, and it's about working smarter, not harder. So so social distancing and also washing our hands, following those techniques, because what I do know, the only way we can really overcome some of these challenges with this virus is just isolate the virus, and you do that by not transporting it or transmitting it. I'll just finish on some of the symptoms, because what happens with us psychologically, we have a more heightened, amplified our emotions now because we're quite sensitive. So we talk about some of the fear that's been instilled in our minds and in our hearts. So it's what we do to overcome fear. And fear and anxiety go hand in hand. And certainly when we look at fear, what are the results of fears? And it's either fight, flight, or fright mode. So fear could look like anger, it could look like sadness, it could look like frustration. So it's how we identify some of those emotions that's related to our thoughts around our situations and our circumstances, but it's how we actually reach out to other people and start putting our hand up and saying, hey, I'm not feeling okay, how do I deal with this? Because what I do know as an Aboriginal man, that we was always raised with a lot of people around us, and to me that's also the answer, is to maintain our immediate family and connectiveness to support each other, share those emotions, share those thoughts, and think out loud with what's going on in our minds and in our hearts. And lastly, I'll talk about another symptom is about our concentration and our thoughts. So our concentration, we could look like we're very tired, lethargic, confused, we're getting headaches. Again, I'm not here to self-diagnose, but what I'm saying is that if these symptoms or all these signs of anxiety and it's becoming worse and worse, I would go and get some professional support where we can, because again, it may come to supporting people and preventing suicide or self-harm, because unfortunately, as we know as blackfellas, is that it's quite common in our communities, but it's not okay in our communities, because I do know there are really good people in our communities and there are really good services in our communities, and sometimes we've got to get over our own challenges or our own battles, and usually the battles we are not externally, it's within our minds and in our hearts. But also what I do know is saying that people have treasure, you just need to know how to dig for it. Again, everyone is a worker, is a helper. That's natural to us as Aboriginal people, as our mob. So again, never ever be ashamed to reach out, to ring someone, or even just to go and drive past them and sing out to them, to maintain your safety and your care, but also just as a gesture to check in to see we're all safe and well. I will talk briefly about some of the myths, because it's like anything, like we'll find out about illnesses or issues and ways to get over it, or to move through it. And it's not about getting over it, it's just about how we manage that. So some of the myths I found out, just yarning with people, and you got it on social media, and social media is a good tool and can be also a challenging tool or way to fuel our thoughts around, I think we'll put it this way, around gammon ways to get rid of this virus. Now, I do believe that pets can't be transferred through pets. I'll just read you this list, but a lot of this information also comes from the World Health Organization. So when you're doing any research or asking for information, the best places are to go to are the public health sites, not Billy blogs from, I don't know, Broome, or any other fella that has that qualifications, experience and skills around what we're doing, because it is serious stuff. I will not shortchange around that. It is serious what we're dealing with, because we are talking about family, we're talking about people, and we're talking about people's lives. So not to be too serious, but also to look at ways that, well, I know that worked for me. Are we taking any bush tucker for this stuff? To me, it's no, and I believe Rochelle would back me up on that one. Some of the myths might be, you can't get it from pets, I said that. It doesn't matter what temperature or climate you're in, it's still transferable or transmittable. Can you recover from it? Absolutely. There's no medication for it, I believe. Sorry, I'm just drinking doesn't fix it. Yeah, so you can't wash it away or wash it in. Bleaching yourself or using chlorine to wash it away. There's no home remedies for it. Like, you know, old ways about garlic and honey. That won't do it. Cold weather, again, the climate doesn't matter. It's still transmittable. And as I said, don't keep fueling or putting fuel on the spot fires with social media, because again, there is credible information on there, and there's information where you think, nah, that's gammon. So yeah, and Libby's just going to talk more about self-care, but I'm certainly, again, appreciative of the opportunity to talk. I am talking quickly because there was a lot of information that I want to cover, but just anxiety, to me, that worry business, you don't want it to become sorry business. And I know that with even being isolated in our homes, it does trigger a few things. It triggers a lot of things around our mob passing. But I look at that as another opportunity to look at, well, hey, how do we get the photos out? How do we get the memories out and start some of that yarning and storytelling around, you know, bringing back those good memories? Because, hey, it was that mob that put us in these positions to yarn and to support each other. We need to continue that yarning, that storytelling, to overcome our personal challenges, but also to feel good around each other, to share those stories, because that's the inheritance that we're passing on to our young fellas or to our mobbers, those shared yarns and stories. Because I guarantee everyone's got a good story about someone in their life, and we just got to keep adding to that campfire.
So I think some of the conversations I'm having more recently with clients and community in general is about being mindful of what we're taking in and how much of it. So it's really tempting to put the morning news on and just leave the news channel run all day long. And all we're going to do really is provoke more worry. So personally, I've chosen to download onto my phone the government's coronavirus app, and I check that once a day. So in the morning is the best time. I find that if I'm checking it at night before I go to bed, I take that thinking, that worry business thinking to bed with me. And then I might lie awake, not able to sleep because I'm too worried. So, you know, once a day in the morning, just make sure I know what's going on. I might listen to one video clip of, you know, one media teleconference, just to know what today's advice is if we move to a new stage, or and I think using this opportunity to change some habits and routines for the better. So things like home cooked meals. It used to be real easy, to, you know, call for an Uber or grab takeaway on the way home, and coffee. So that grabbing a drive-through coffee, which now we're all thinking about who's handled the cup beforehand. And so use this opportunity to make your coffee at home, maybe in a takeaway cup if you need to go somewhere, or just stay at home with it. And our food. I think the other thing is we relied really heavily on our incidental exercise. So parking a long way from the shop, we might not be doing that now. Most of us are certainly not driving from home to work and walking to the office and walking back to the car and all that stuff that we're not doing. But what we're doing is a deliberate once a day walk for exercise. So imagine we're still doing the incidental and the deliberate once a day. That deliberate once a day for exercise is also really helpful to move our body around, get us out in the sunlight, not because it'll kill the virus, but because it's good for us in general. It's good for our mental health to be out moving around, getting some fresh air and some sunlight. And the yarns, lots of us are calling people to have a yarn. Don't know about other mob, but during the day I might have a yarn with someone in the office that's not really meaningful, but it's an interaction with someone else. If we're working at home on our own now, or we might just have the kids driving us mad at home with us, we are actually calling people once a day to check on other people, have a meaningful yarn. Let's keep those good habits after this period of time. And it's important that we keep a routine. Might be real tempting to get up and stay in the pajamas all day long, but it's important that we get up, we have a shower, we eat breakfast, we actually have a space that we work in and another space that we relax in, and try and keep that routine. If we don't do that, it's going to be more challenging to transition back to the what Craig's been calling BC, before coronavirus. So our lifestyle is adapting, but we need to remember that light at the end of the tunnel, that it'll be back and we'll get normal life back. For some people, it's going to feel like going back to work after a really long holiday. And for other people, you know, hopefully it won't be all that challenging. But I think using this time, I know I'm seeing lots of stuff and hearing lots of stuff about people decluttering and organising their house and doing things that are helpful. I think they're really important things, but routine is important too. So, you know, stay safe and stay well, and we'll, is there something you want to add?
Yeah, again, just we've got to bring normality back into our life as much as we can. It will pass. We know, like, even ways of storytelling around yarns, you always know when there's a big storm coming, but hey, the storm's here. Yep. When we run inside, we can't stop that storm. It's still going to go, and it'll go around us. Hopefully it won't come near us. But it's what we do to prepare for a storm. And it's all around, even old ways. We did it, we planned for it. Everyone had roles, everyone had jobs to do. So whether you're stuck in a unit or on property or in country or rural, remote, it's a collaborative approach. It's doing it together. It's sharing our ideas. It's sharing our yarns, and it's sharing our plans to get through this. We will get through this. We probably are the most resilient people in the world, on the planet. I know we're the most creative, and we got the strongest spirit. So with that formula, that is the way we will get through it. I actually believe in every one of you. I believe in your mob, but we need to keep reminding ourselves of that. It's a positive self-talk, not the negative thoughts. We call it stinking thinking, the overthinking, the over. Damian did talk about it. It's how we respond, or not, how we be proactive, not reactive. Reactive is how we respond with our emotions instead of our thinking. So we've got to connect our minds and our thoughts with our head and our heart, and then move through this stuff together, because with all the challenge we have with all of our mob that are quite vulnerable, we need to now to step up and guide and lead our people through this stuff too, because everyone's a leader. We just do it all differently. You've got aunties cooking in communities that have been holding families together for many, many years. And it's that will, it's that, I think NAIDOC a couple of years back saying, you know, because of her. It's because of her and because of us we will get through this. So again, I want to really appreciate, or say, I appreciate the opportunity and acknowledge that the work that everyone's doing, particularly in this space, this time. This is a hiccup or a little hurdle in our life. Again, we'll get through that, and I'm quite confident you people have the treasure to actually push through and also guide some of these non-Aboriginal people and service providers through this, because again, we got the tools, we got the ways. We just need to dig into our toolbox and bring out those tools that are going to be relevant for our mob. Again, how do I know I've got tools? Because my kids used to leave them all over the yard. And saying that, I'll leave you with that. But again, thanks for the opportunity, Tori, Damian, June, Rochelle, and all the mob out there. And please, if there's any questions or comments or anything that we can do from a little service here in Western Sydney, we're here to open up to see what we can do to offer ideas, or even some of that feedback to Damian around, you know, what can government do? Well, I know they're not doing as much as they should be doing, but that's a common yarn everywhere. But again, thanks for the opportunity. On behalf of my people, Gumbangi and Yuan, I want to acknowledge all the lands and elders that are still continuing and those stories, and we just need to keep this campfire alight around care and self-care. And it's not about what we're doing, it's about how we manage the way we do it. That's healing. Thank you.
Yeah, thank you very much for that, Jan there, Craig and Libby. Obviously, some very good and practical tips around how to, I guess, first of all, identifying what anxiety actually is, and then practical tips on how to manage that within ourselves. So, yeah, thank you very much for taking the time out, and also to Rochelle and Damian. Very much appreciate you guys taking the time and coming in and having a yarn with everybody. And just want to put out to the attendees as well, this is our first webinar, so if you have any feedback that you'd like to obviously give to us so we can make these better as we go, by all means, please give me an email. My email's on the registration, so you can contact me via that. So torip@fpdn.org.au. So thanks again, everybody. Stay safe and stay well. And like you said, Brother Craig, we can't stop the storm from happening, but we can manage how we react to it. So I just want to thank you guys once again, and we'll see you on the next one. Cheers.
Thank you. See you.
Thank you, Tori. Excellent.
Thank you,
Thanks,
everyone.
everyone. Brilliant. Thank you.